I'm Christina. I'm your nurse practitioner today. How you doing?
Doing great.
So we're here to do a physical assessment. Is that okay with you?
Yep.
Okay, let's go ahead and get started. I'm just gonna start with your head. I'm gonna look at your head for symmetry, lesions, hair distribution, masses, nodules. I don't see anything. Your anterior fontanelle should have closed by 18 months, and your posterior fontanelle should have closed by 2 months. I'm just gonna palpate your head if that's okay.
Okay.
Okay. Is that tender at all?
Nope.
Okay. It's symmetrical. I don't feel any masses or lesions in there. See any lesions? So could you close your eyes for me? Okay, you can open them and raise your eyebrows. Okay, and you can relax and smile for me. Okay, great, you can relax. His facial nerve, his cranial nerve number 7 is intact. Now I'm gonna have you close your eyes again, and I just want you to tell me, I'm gonna touch you with these cotton balls. I just want you to tell me if it feels the same, okay? Does it feel the same?
Yes.
Does that feel the same?
Yes.
Does this feel the same?
Yes.
Okay. You can open your eyes now. And I'm gonna put my hands on your masseter muscles, and can you just clench your jaws? Okay, and can you open and close? Okay, and on your temporal muscles, can you clench your jaws again? Okay, and you can relax. So his cranial nerve number 5, his trigeminal nerve, is intact, motor and sensory. There is no clicking or restricted motion when he opens and closes his mouth on his temporal mandibular joint. So now I'm gonna give you this glass of water,
Okay.
and I'm gonna go behind you, and I'm gonna palpate your thyroid as you take a drink of the water, okay?
Okay.
So if you'll just look down and take a drink. Okay, I can feel his thyroid. It moves up and down when he takes a drink. Thank you. And there's no nodules. And was it tender?
No.
Okay, great. Now I'm gonna palpate your lymph nodes, okay? All right. So I'm gonna start with your preauricular and your postauricular and your occipital and your tonsillar and your posterior cervical chain and your anterior cervical chain and your submental and your submandibular. Can you shrug your shoulders up for me? All right, and your supraclavicular and your infraclavicular. Okay, you can relax, thank you. I'm gonna have you raise this arm up, and I'm gonna palpate your axillary lymph nodes and your epitrochlear. Okay, and then I'm gonna do it on this side too, okay? So your axillary lymph nodes and your epitrochlear lymph nodes. Was any of that tender? You can put your arm down, thank you.
No.
No tenderness noted?
No.
Okay. So we're gonna move on to your eyes. So I'm gonna look at your eyes, and I'm looking at your eyelids and your eyelashes and your conjunctiva, which is pink, and your sclera, which is white, and your corneas, which are clear. Your irises are blue, and your pupils are equal. There's no anisocoria. There's no ptosis noted. No redness or discharge. Could you hold this out in front of you
Okay.
and cover one eye and read the smallest line you could read, please?
LTFPH.
Okay, and switch eyes, please.
LTFPH.
Okay, and then just read the smallest line with both eyes.
LTFPH.
Okay, thank you. So his vision is 20/20 without correction, and now I'm going to have you cover one eye, and I want you to tell me when you see my finger, okay? Look at me, look at my nose. Tell me when you see my finger.
Yes.
Okay,
Yes.
okay,
Yes.
okay,
Yes.
okay. Let's switch eyes. Same thing.
Yes. 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 Yes.
Okay. And I'm going to dim this light. I'm going to shine a light in your pupil.
Okay.
Okay. And this one. Okay. So his cranial nerve number 2, his optic nerve for sensory and motor is intact. Now I'm going to look at your cranial nerve number 3, your ocular motor. So I'm going to shine a light in your eye again, except I'm going to look at the opposite pupil to make sure that it reacts as well. Okay, so I'm going to hold those eyes for you. All right. Okay. And on this side. Okay, great. Thank you. Let me turn the light back on. So that was his efferent nerve on his sensory nerve on his ocular motor. It is intact, and on his previous on direct light was his afferent nerve. So now I'm gonna have you just look at me and hold your head still and follow my finger, okay?
Okay.
Okay, very good, thank you. So that was testing his ocular motor, cranial nerve number 3, his cranial nerve number 4, his trochlear, and his cranial nerve number 6, his abducens, which are intact. There was no nystagmus and there was smooth motion noted. Now I'm going to look at your ears. So I'm just going to inspect them. They seem symmetrical. There's no discharge or lesions or masses on your outer ear. I'm just going to palpate. Your ears. Is that tender at all?
No.
Okay. So this is your pinna and your tragus and your mastoid process. That doesn't hurt?
No.
Okay. Now I'm gonna look inside your ear. Okay. There is no erythema. There is no discharge. I can see his tympanic membrane on both sides. It's pearly gray. It's not bulging or perforated or retracted. I can see the cone of light in his left ear at 7 o'clock and in his right ear at 5 o'clock. So I'm just gonna go behind you and I'm gonna whisper something and then I want you to repeat what I say, okay?
Okay. 1, 2, 3. A, B, C.
Okay, so his vestibulocochlear cranial nerve number 8 is intact. Now I'm going to look at your nose. So I'm looking at your nose for symmetry and deviation. I don't see any lesions or anything. I'm just gonna touch your nasal bridge, okay? Is that tender?
No.
And your soft tissues? Is that tender?
No.
Okay. Now I'm gonna palpate your maxillary sinuses. Is that tender?
No.
Your frontal sinuses. Is that tender?
No.
Okay, very good. Can you occlude one of your nostrils and just breathe in for me? Okay, great. And the other side? Okay, great. So there's no deviation, no obstruction noted. So, could you close your eyes and I'm gonna have you smell something for me. If you'll plug one nostril again. Okay, and smell this. What's that smell like?
Candle.
Okay. And other nostril. What's this smell like?
Alcohol.
Okay, very good. Your cranial nerve, your olfactory nerve, which is cranial nerve number 1, is intact. Now I'm going to shine a light in your nose. If you can just tilt your head back a little bit for me. So his nasal turbinates are patent. There's no bleeding. I don't see any polyps. His mucosa is pink, and there's no rhinorrhea, no discharge, no signs of infection. So now I'm just going to look at your mouth. Can you open and close your mouth for me? Okay, I'm looking at your lips, and they're symmetrical and pink, and your mouth closes all the way. Now if you could open your mouth, and I'm going to look at your gingiva. Your gingiva is pink and moist. And can you stick out your tongue for me and move it side to side? Okay, that's good. You can put it back. So his hypoglossal cranial nerve number 12 is intact. There's no fasciculations at rest, and it's strong and symmetrical. Open your mouth for me again. I'm looking at your subglossal membranes and your buccal membranes, and they are moist and pink and intact. Now I'm gonna ask you to say "ah." Are you okay? His uvula rises. His soft palate is symmetrical. There's no exudate or erythema or discharge or signs of infection or swelling. Could you take a drink of water for me? Okay. So, your cranial nerve number 10, your vagus nerve, and your cranial nerve, number 9, your glossopharyngeal nerve are intact. Now we're going to move on to your respiratory assessment. So I'm just going to inspect your chest for symmetry, for color. I've been watching you breathe since I've been talking with you. Your respiration rate is regular. I'm not seeing any signs of distress. There's no nasal flaring. There's no muscle retractions. Your color is normal for your ethnicity. So I'm just going to palpate your chest, and I'm just feeling for something called crepitus. Is it at all tender?
No.
Okay, I'm going to do it on your back side here too. So there's no crepitus noted. Now I'm going to check for some tactile fremitus. So if you could just say 99 for me.
99.
Again.
99.
Again.
99.
Okay, so I can feel the vibration of the tactile fremitus, and if you'll take a deep breath for me. Okay, thank you. You can lean back. His chest rises equally and bilaterally on deep inhalation. Now I'm going to just percuss your chest. Can you lean forward just a little bit? Thank you. Okay, thank you. So on percussion, his it's resonant sound. There's no dullness, no hyperresonance, no timpani noted. Now I'm just going to go ahead and listen to your lungs, okay?
Okay.
deep breath. Again. One more time. Okay, now listen a couple times here. So raise your arm up. Deep breath. One more. And then we'll listen on your other side. Okay, thank you. So your breath sounds are clear and equal. There's no crackles, no wheezing, no rhonchi. So I'm going to move on to your cardiac assessment. I'm just going to lie you back. I'm going to lie you flat. Sorry about that. I'm going to go ahead and lie flat. And I'm inspecting your precordium for heaves and lifts, which I don't see any. And I'm going to palpate your precordium. I don't feel any thrills or abnormal pulses. I got you here. I'm going to palpate your PMI. Okay, great. I'm going to sit you back up. Thank you. Okay, now I'm just going to listen to you. So this is your apical, aortic, pulmonic, herbs, tricuspid, mitral. I'm going to listen with my bell. Aortic, pulmonic, herbs, mitral, tricuspid, and mitral. Okay. Now I'm going to turn my diaphragm back over and I'm going to have you lean forward. I'm listening for aortic stenosis. And I don't hear a murmur. So I'm going to lie you down and have you kind of turn to your left side the best that you can. And I'm going to listen to your mitral valve too, okay? Just do the best you can. So I'm going to use my bell. Listen to your mitral valve. Versus stenosis. And I don't hear a murmur there. Thank you. I'm going to sit you up. To about 45 degrees, 40 degrees. You can lay all the way back. I'm going to have you turn your head to the left. Thank you. And I'm going to look at your jugular vein. I don't see any distension or any abnormal pulsation, so I'm going to sit you all the way up now. Thank you. Okay, now I'm going to listen to your carotid arteries. There are no paresis appreciated. I'm going to palpate your carotid artery. And I feel a medium strength with strong upstroke. So now I'm going to move on to your peripheral vascular system. I'm just going to look at your arms and look at your legs, and I'm noting your hair distribution is normal and your skin tone is normal for your ethnicity. I don't see any edema. I don't see any varicosities. I don't see any scarring or any signs of trauma. Can you let me see your hand. Thank you. So your capillary refill is 2+, and your skin is warm, and there's no clubbing. Can you stick your fingers together, your fingernails together, just like this for me? Just your 2 pointer fingers. Yeah, that's great. Okay, so there's no clubbing noted. Okay, you can relax. So I'm gonna feel your pulses. So I'm gonna feel your radial pulses and your brachial pulses. Okay, you can relax, bud. And your popliteal pulses. And your posterior tibial pulses. And your pedal pulses. I promise I'm feeling his pedal pulses. Your pulses are 2+, and they're equal. And that concludes our exam. Thank you very much.
Thank you.